Hello and welcome. Today, we're going to dive into something called gestational diabetes. Now, it's actually one of the most common complications of pregnancy. And I know, that might sound a little intimidating. But the most important thing to know right up front is that it is absolutely 100% manageable. So let's break down exactly what it is and, more importantly, how to handle it.
I mean, think about it. Your body is doing something truly miraculous, and that requires a ton of adjustments behind the scenes. And this question, right here, it gets to the very heart of what gestational diabetes is all about. It's a temporary thing that's all about how your body handles energy during this pretty incredible time. So what exactly is it? Well, in a nutshell, gestational diabetes mellitus, or GDM for short, is just high blood sugar that shows up during pregnancy. It's not something you had before you were pregnant, and it usually pops up a little later on, in that second or third trimester as your baby is really growing and your body's chemistry is changing big time.
So, what's actually going on inside your body to cause this? It really helps to think of it like a biological tug of war. On one side, you have the hormones your body needs for a healthy pregnancy, and on the other, you have the insulin it needs to manage sugar.
Okay, so on any normal day, the process is beautifully simple. You eat something, and the sugar from that food, that's glucose, goes into your blood. Your pancreas then sends out insulin, and you can think of insulin as a key. It goes to your body's cells, unlocks the door, and lets that glucose in to be used for fuel. It's a perfect system that just works. Until pregnancy changes all the rules.
And right here is where the hiccup starts. During pregnancy, some of those essential pregnancy hormones basically go around and gum up the locks on your cells. The insulin key is still there, floating around, ready to work, but it suddenly struggles to open the door. This is what doctors call insulin resistance, and it's the reason sugar gets left behind building up in your bloodstream.
So who are the culprits changing all those locks? Well, it's this team of hormones, most of them produced by the placenta. Biologically, their main job is to make sure your growing baby gets a nice, steady supply of glucose. But the side effect of that very important job is that they can make your own body less sensitive to your insulin.
So, understanding the why is one thing. But what does it all mean in the real world? Let's talk about the potential risks. And look, the point here is not to cause any alarm at all, but to really underline why managing this is so crucial for the health of both you and your little one.
For the baby, the main risks really come from all that extra sugar. See, the glucose crosses the placenta, and the baby's body reacts by, getting bigger. This is a condition called macrosomia. Then, right after birth, their little pancreas might still be in overdrive, pumping out too much insulin, which can cause their own blood sugar to crash, and that can be pretty dangerous.
And for mom, a larger baby can mean a tougher delivery, which often leads to needing a C-section. High blood sugar can also make it harder for your body to heal from that surgery. And this last one is really important. Having GDM is a strong heads up that you have a higher risk for developing type 2 diabetes later on in life.
Okay, that was the tough part, I promise. Because even though those complications sound serious, the fantastic news, the really good news, is that GDM is highly preventable and very manageable. So, let's totally pivot. What's the playbook? How do we take control?
All right, this next part is all about action. These are the things you can do. This is your guide to taking control, managing your health, and really creating the best possible environment for you and your baby.
First up, knowledge is power, right? So are you at a higher risk? Things like your pre-pregnancy weight, if diabetes runs in your close family, if you've had GDM before, or even just being over 25, they all play a role. Just knowing where you stand helps you and your doctor get ahead of the game.
Your diet is honestly the cornerstone of prevention. The whole goal is just to keep your blood sugar nice and stable. Eating smaller, more frequent meals really helps. So does choosing those complex carbs, brown rice, oats, and loading up on veggies full of fiber. And just as important is what to limit. So steering clear of fried foods and maybe not going overboard on super sugary fruits.
One of the simplest and most effective ways to help your body use that insulin better is exercise. And for most pregnant women, a brisk 30-minute walk every day is just perfect. It's safe, it helps regulate your blood sugar, it helps manage weight, and it's even a fantastic stress buster.
Okay, mark your calendars. This right here is the magic window. The screening for gestational diabetes, which is usually done with something called an oral glucose tolerance test, almost always happens between 24 and 28 weeks of pregnancy. This test is the key to catching it early so you can start managing it right away. And beyond just diet and exercise, your whole lifestyle makes a huge difference. Managing stress is a big one, because stress hormones can actually raise your blood sugar. Same with not getting enough sleep. And making simple swaps, like choosing water instead of soda and saying no thanks to fast food, all those little things add up and make a world of difference.
So let's bring this all home. Let's put it all together. The goal here isn't just about having a healthy pregnancy, it's about setting up lasting health for two people, you and your child. And it really just comes down to a simple plan of action.
It really all boils down to this easy 3-step plan. First, and this is so important, understand that this is hormonal. It's about your body's response to pregnancy. It is not a personal failing in any way. Second, make a balanced diet and a daily walk your top priorities. And third, just don't skip your checkups. That screening test is your best friend for early detection. That's really the core of it all.
Ultimately, every single healthy choice you make during pregnancy is a gift you give to two people. It's an investment in your own well-being right now and your long-term health later, and it gives your child the absolute best start in life. So I'll leave you with this question to think about. What's one small, healthy choice you can make today?